All right, let's just jump right in. You've seen them, right? Those super powerful emotional testimonials from patients whose lives were totally changed by some medical procedure. It's a huge part of how we all make healthcare decisions. But have you ever really stopped to think about the journey that story took to get from a private moment in a doctor's office to your screen? And that quote, that really gets to the heart of it, doesn't it? A real person's story just cuts through all the noise. It stops being about marketing and starts being about seeing a reflection of your own fears, your own hopes in somebody else. It makes you feel like, hey, maybe I can do this too. But that leads to the big question, right? How does something so incredibly private, a personal medical victory, become a public marketing tool? It's definitely not as simple as just asking someone if you can share their story. There's this really delicate, legally complex process behind it. And if you get it wrong, the consequences can be serious.
Well, here's the thing. It's because these stories are so sought after for one simple reason. Authenticity is everything, especially in a field like healthcare, where trust is, the absolute currency. A genuine story from a real patient, that's the most powerful and persuasive thing a practice can possibly have.
So you've got this incredibly sensitive, powerful asset. How do you handle it? Well, it all boils down to one fundamental principle: consent. And let me be clear, it is 100% non-negotiable. And we need to be really clear about what informed consent actually is. It is so much more than just a quick signature on a form. It's a massive ethical obligation. It's about making sure the patient knows exactly what they're agreeing to, exactly how their story will be used, and that they have total control over their own narrative. It's the bedrock of the entire doctor-patient relationship. And really, when you think about it, this choice puts you at a fork in the road, with two very different destinations. On one side, you get proper consent. That builds trust, leads to ethical growth, and keeps you legally safe. But the other path, sharing without consent, you're looking at a destroyed reputation, massive legal fines, and most importantly, you could cause real harm to a patient. The stakes just couldn't be any higher. Now, this isn't just about ethics. It's also about the law. You've got these two major rulebooks that you have to follow. In the US, it's HIPAA, and over in Europe, you've got GDPR. Both are designed to give patients complete control over their sensitive health info. And trust me, violating them comes with some pretty severe penalties. These aren't just suggestions, they're the law. Okay, so the stakes are high, the rules are strict. How on earth do you do this the right way? Well, luckily, there's a really clear ethical playbook that actually breaks it all down into a simple 3-step process. And it's not as complicated as you might think. It really just comes down to these 3 key things: having the right paperwork, choosing the perfect time to ask, and then always putting the patient's comfort and privacy first through the whole thing. All right, let's dig into step 1, that consent form. It has to be crystal clear. We're talking zero confusing legal jargon. It needs to spell out exactly where a patient's photo or story might pop up. Is it going to be on Instagram, the website, a printed brochure? And this is crucial. It has to state loud and clear that the patient can change their mind and pull their consent at any time. Okay, step 2, this one is a biggie. Timing is absolutely everything. The sweet spot is usually at a follow-up appointment after a major procedure, the day the braces come off, or when they see their brand new smile for the very first time. When a patient is just genuinely thrilled and grateful, asking them to share feels less like a business transaction and more like an invitation to inspire other people. And that brings us to the third and maybe the most important step. The patient's comfort is everything, period. You do that by offering options for anonymity. It shows you respect them as a person, not just as a story. Maybe they're cool with sharing their journey, but don't want their full name out there. That's totally fine. And if they just say no, you respect that decision. Full stop, no questions asked. So that's the playbook. But what happens when a practice actually puts it into action? Let's take a look at how this ethical storytelling really works out in the real world. Let's talk about a practice we'll call Smile Well Dentistry. They decided to totally shift their focus to sharing these authentic patient journeys. One of the first people they featured was Sarah, a patient who had this severe dental anxiety, but finally overcame it to get the smile she'd always dreamed of. They carefully walked her through the whole consent process, and she was more than happy to share her story. And Sarah's story, it was just so genuine, it really connected with people who had those same exact fears. The result for the practice? Whoa, it was fast and it was big.
We're talking a 30% increase in new patient referrals. And that was in just 6 months. I mean, that's incredible. It's just proof that doing things the right way, with the patient's best interests at heart, is not only good ethics, it's good business.
Okay, that's an amazing case study. But how do you know, really, if these stories are working long-term? How do you actually measure the impact of a story?
Well, you gotta look at the data. It tells a story all on its own. Are people liking, sharing, commenting on social media? That tells you the story is resonating. Are people clicking over to the smile gallery on your website? That shows they're actively looking for proof. And the big one, when you ask new patients, hey, how'd you hear about us? Are they mentioning a specific person's story? That data tells you what's working and what isn't.
Right, so this is super interesting if you're, say, a dentist or a marketer. But why should you care? Why does this matter to the rest of us? It really boils down to this. If you're a patient, you need to know that you are in the driver's seat. You have rights, and you have complete control over your own story. As a consumer, you can now start to see the difference between marketing that's built on respect and marketing that's, well, not. And for any professional out there, this is just a great reminder that the best way to grow your business is by building genuine, rock-solid trust. So I'm going to leave you with a final thought. Now that you know all this, the next time you're scrolling and you see a before and after photo, or you watch a patient testimonial video, are you going to see it in a whole new light? Will you wonder about the consent, the timing, and the trust that had to be built just for you to see that story in the first place? Something to think about.